Welcome, everyone. Today we'll dive into some really practical tips for parents when using OTC medicines for kids. It's all about safety first,
Yep,
right?
absolutely. Safety is key. So, what's one of the first things parents should always keep in mind?
Well, for starters, always read and follow the medicine label carefully. It's like a manual that tells you exactly what to do. You really want to be sure you're giving the
Hmm.
correct dose for your child's age.
Right, and speaking of dosage, they also stress using the proper measuring device, not a regular kitchen spoon.
Exactly. It might sound like a small detail, but using the right tool can make all the difference. And dosing by the child's weight is super important too. When possible, check those instructions carefully.
That reminds me, there's a strong warning about not giving any medicine past its expiration date, isn't there?
Yes, that's spot on. Expired meds can be ineffective or even risky. And another key tip is to use only the medicine specific for your child's symptoms. Don't, mix different meds that might have the same active ingredients.
Absolutely. I'm curious, though, about the issue with cough and cold meds. Some say these can help the child sleep, but the advice clearly warns against using them to make children sleepy.
Right, and that's an important point. While it might be tempting to use them as a sleep aid, they can dangerously sedate a child. Besides, cough and cold meds should only be given if they actually target the specific symptoms the child is experiencing.
I get that, but don't you think there might be rare cases where a slight sedative effect could help a very restless child?
I see your point, but really the guideline is there for a reason to avoid unintended side effects. It's best not to let the sedative behavior become a reason to misuse the medicine.
Right, that makes sense. And then they've got the big no on aspirin for kids, especially with cold or flu symptoms.
Correct. Never give aspirin containing products to children or adolescents in those cases due to the risk of serious complications. Plus, always store the medicine safely out of reach of children.
Yep, it's pretty clear. Follow the dosing directions, stick to age and weight appropriate guidelines, and don't mix medicines that might duplicate active ingredients, right?
Exactly. And if a child shows any side effects or reactions, stop the medicine immediately and contact a healthcare provider. These tips really empower parents to be cautious and informed.
In the end, it's all about careful use and checking in with your doctor. For more details, you can always head over to knowyourotcs.org. Thanks for breaking it down today.